This lecture is just on the displacement disorders. So displacement disorders can refer to any organ in the pelvic cavity that is not where it's supposed to be. So common ones that we'll see is something called a cystocele. This is where you have a sagging bladder. You can have a rectocele, which is a sagging rectum. And then more commonly what we see and what I'm going to talk about in this lecture is going to be your uterine position disorders, also known as uterine prolapse. And that's where the uterus can be at various different levels of sagging when we're looking at it in reproductive health. All right, so displacement disorders, so this is from your book. You know, we've got where if you go in and do a vaginal exam, you may actually see the uterus bulging into the vaginal wall. And so that would give us an indication that we have some kind of displacement disorder. So if you go in and look vaginally, you know, it doesn't always necessarily mean that it's a uterus there. It could be their bladder sagging in there. It could be their rectum sagging in there. But any type of bulge on vaginal exam is suspicious for some kind of displacement disorder. So diagnostic-wise is we need to figure out which organ it is that's causing the problem. So they can do this with an ultrasound. They can do a hysterosalpingography, which means that they're going to go in and do a direct visualization of the uterus and the ovaries. We can do a CT scan, we can do an MRI, or we can do endoscopy, which can kind of give us a visual scope and see what organ we're dealing with. So therapeutic interventions, there's a couple different things that they can do. One of the things that your book mentions is something called pessary. And pessary is a supportive ring that can be taken out on a nightly basis as a supportive ring to kind of hold the organs in place, or it can be in place for several months. What you need to keep in mind is this is still a foreign object, so it needs to be cleaned properly, and we need to make sure that it stays in the location that it's supposed to and not migrate somewhere else, because if it migrates somewhere else, it can definitely cause major problems. Some of these displacement disorders require surgical corrections. So it might be that they'll, shorten some of the muscles, some of the fibrous tissue to shorten and lift everything up. Commonly, though, when we're dealing, especially with like a uterine displacement, a hysterectomy is going to be the common surgical procedure that they're going to do. Okay, but again, if we're dealing with a young female, we certainly don't want to do a hysterectomy if it's not warranted. We do teach our patients a lot about Kegel exercises, and again, you'll talk about this in OB, but this is where you teach the patient to squeeze their pubococcygeal muscle, or if they were squeezing like to hold their bladder or to hold their urine. So we teach them to hold for 10 seconds, relax, and it should be repeated about 15 times a day to improve that muscle strength. So here are pictures from your book of uterine position disorders. Okay, so we've been talking about displacement, where we can deal with a bulge, and I'll show you guys what uterine prolapse looks like in a second. But you can also have the uterine position be altered. So in Figure A up there, that is called an anteversion, and that's where the uterus is tilted forwards. B, which is also on the top up there, that is an anteflexion. And that just means that the upper portion of the uterus is tilted forward. So you can kind of see the difference in the two. Like one, the actual uterus, the whole uterus is tilted forward, whereas the second one, only the top of the uterus is flexed forward. Figure C, that is called a retroversion, means that the uterus is backwards or displaced backwards from where it should be. And Figure D is called a retroflexion, where the upper portion is tilted backwards. All of these uterine position disorders actually make it more difficult for conception to occur. So if we have somebody who is having fertility issues, this is something that they'll look at and see, like, do you have a displaced uterus, just because it will make things a little bit more difficult. Now here is where we have uterine prolapse, okay? So in Figure A up there, like, that's what it's supposed to look like. That is your normal uterine anatomy. As we start looking at, the various levels, you can kind of see how the uterus is progressively sagging further and further into the vaginal area. So figure B, that is your first degree, and that is described as less than half of the uterus sagging into the vagina. Figure C, that's where we have a second degree. This is where the entire uterus is in the vagina. It's not outside yet, so that's what makes it a second degree. And figure D, that is your third degree, and that's where the uterus is actually outside of the body, okay? So depending on the level or the degree of prolapse, a lot of times what we're looking at here is a surgical intervention or complete removal if necessary. So your therapeutic interventions, just like for our other organs that we talked about, it could be pessary, which again, that's that ring that is placed in there. We're going to teach the female, Kegel exercises to tighten up those muscles. And then again, surgery a lot of times is going to be warranted, especially if we're dealing with like a second degree or a third degree prolapse. A lot of times we're looking at a hysterectomy. But again, we're going to take the female's age into consideration. And one of the common reasons why we start seeing uterine prolapse is a lot of times because a woman has had multiple pregnancies. So it is something we will talk about with her and see what her options are going forward. But those later degree prolapses, surgery is usually going to be warranted.